Did you know that around 15% of the world, that's about 1 billion people, are living with disabilities? If we scale this down to just the US, we're looking at the equivalent to 1 in 4 adults. And yet, this significant portion of the population regularly face disparities within the medical industry. With higher rates of diabetes, stroke, heart disease and more, it begs the question, how do we close the disability gap? To know how to tackle the problem, we need to begin at the root cause of the issue. Making our medical centres more physically accessible and accommodating to sensory issues would be a great place to start. Hospitals tend to have bright overhead lighting, strong smells, loud noises and alarms, all of which contribute to alienating a large portion of our disabled community. And as for physical barriers to access, having drop-down curbs, wider doorways, disabled parking and ramps rather than staircases would make a site much more disability-friendly. So, what else can be done to make our healthcare spaces suitable to all people? At Wayne State University, the Michigan Developmental Disabilities Institute, or MI-DDI, have recognised the issues within the medical industry and have developed a clever way to get spaces to combat issues with access.
And our vision is healthy communities for all. And the way that we're going about this is we've created criteria to become a most valuable provider, or MVP certified. And this means that a site is accessible, sensory friendly, and welcoming to all people, including those with disabilities.
In Michigan, the number of MVP sites is ever growing. The first of which was the Wayne Health Mobile Unit, who focused their efforts on creating a welcoming and supportive environment for the disabled community to receive healthcare.
As the first to become MVP certified, we really wanted to incorporate the ability to reach all patients. And so working with Sharon and MVP, we were able to revisit our current vans. We had 7 at the time, and really reimagine how those vans could be made fully accessible to all members of the community. But along the way, we always wanted to know what were people's challenges from a disability perspective and how we could address and help meet those challenges.
I first encountered the Wayne Health Mobile Unit at a community event. To have that mobile unit there with the ramp deployed, they felt like they belonged there because there was access created for them. So that's a beautiful thing.
And over at the Detroit Health Department, they've created a sensory treatment room to put patients' comfort and safety at the forefront of healthcare.
Having an environment that's warm, that's friendly, that's very patient and understanding to meet the needs of the clients, it's been very, very positive.
Where they can feel comfortable and safe in our care.
So it's clear that considering things such as access and sensory issues makes a huge difference when making the disabled community feel welcome in a space. Addressing these things could mean much more of the population would be able to safely receive the care they need. But the problem is bigger than that. Healthcare providers aren't learning about how certain illnesses might affect people with disabilities differently. This is a huge contributing factor to causing major health disparities, when what we need to achieve is health equity.
It's too large of a demographic to continue overlooking, and there is not enough focus on this population when healthcare providers go through medical school.
Which means there's a gap in disability data.
We cannot show how we are addressing reducing disparities if we don't have good baseline data on disability. So we are asking that disability status be consistently and systematically collected across sites.
To close this gap, the MVP offer training to address the attitudinal barriers caused by ableism and bias in healthcare professionals.
People with disabilities often feel like they're not seen as a whole person when they're receiving health care because the tendency is to look at the immediate medical need. And we need to start counting disability through the data that we gather.
The MVP certification is just the start of creating a more inclusive world in medicine. And gradually, as more and more healthcare organisations become certified, we'll be taking a promising step towards health equity.